Hi everyone. I did my project on post-mastectomy lymphedema. I had the opportunity to interview Peggy, a breast cancer survivor who had a double mastectomy and as a result of that developed lymphedema, and her physical therapist, Donna Kubik, who followed her throughout her treatment. Some of the things I'm going to touch on in my presentation are what post-mastectomy lymphedema is, how common it is, the treatment methods, a little bit of Peggy and Donna's journey, and then one of the most important factors is the financial hardships that lymphedema can cause after a breast cancer diagnosis. So, what is post-mastectomy lymphedema? Well, our lymphatic system stretches from our head to our toes, and it's a network of paths and channels and nodes that help filter and drain lymphatic fluid from our body. So, when a woman elects to have a mastectomy, her breast is removed along with some, if not all, of the lymph nodes in her axillary or underarm region. And when those nodes are removed, that lymphatic fluid can no longer drain properly and then backs up and causes severe swelling in the arm, chest wall, and sometimes the neck and the face. About 35% of early stage breast cancer patients are going to elect to have a mastectomy. About 10 to 15% of those patients will develop some form of lymphedema, and about 1/3 of those patients who develop lymphedema will progress to chronic lymphedema within 5 years of initial onset, and chronic lymphedema is lifelong. It's typically painful, but it requires lifelong maintenance. Some of the signs and symptoms, well, the most primary symptom is obviously the severe swelling in the arms, in the chest wall, and the neck and the face. As you can see in the images, the arms sometimes swell up to 1.5, maybe even double the size of the other arm. But lymphedema is typically felt before it is seen. So a woman who is developing lymphedema will feel a fullness and a tired and achy feeling in her arm and in her chest, tightness of the skin, tingling sensation, and they'll have limited range of motion, which means they probably can't get their arm above their head or even at a 90-degree angle. In addition to the physical symptoms of lymphedema, there's a psychosocial component that's also involved. After women have a mastectomy, they're already dealing with a lot of body image issues, but now adding a diagnosis of lymphedema on top of that, where their arm is visibly much larger than the other arm, can cause a lot of disturbed body image issues and can lead to anxiety, depression, reduced quality of life, and also impaired sexual functioning. Lymphedema therapy is treated in a number of ways. Most of the time it's a combination of different treatment methods, which can include manual lymphatic drainage and a bandaging technique to help reduce swelling in the arm, and then compression pumps and garments for maintenance. And that's what I have images here of: wrapping techniques, compression pumps, and garments. And those methods all work to help keep the lymphatic fluid moving back through the arm channel, and to keep swelling reduced and to stop the risk of infection. So some of Peggy's journey: Peggy was diagnosed with stage 2 breast cancer in June of 2014. She had a double mastectomy, and she had 15 lymph nodes removed from her right side and 12 from her left. She progressed really well with therapy when she was referred in January of 2015. She worked with Donna Kubik, who worked to fit her with compression garments and reduce her swelling as much as possible. But at the same time, Peggy was also going through radiation, which really set her back because the radiation damaged the remaining lymph nodes in her right arm. So she had severe swelling when she returned to therapy after radiation. That was way worse than when she initially started. So she went from probably moderate lymphedema and progressed to chronic lymphedema. And now, in addition to wearing compression garments every day and every night, she also has to use a compression pump for 30 minutes each day. Peggy was not only dealing with a breast cancer diagnosis, undergoing radiation, and the body image issues from a mastectomy, but now she was dealing with lymphedema, and she was really overwhelmed because she knew that she was getting over cancer, but now she had a lifelong condition as a result of that, because lymphedema is not curable, it's only manageable. And it tends to get worse as time progresses. And I think that really overwhelmed Peggy, knowing that not only was she worried about changing in front of her husband because of the scars on her chest, but now she had swelling issues that she was dealing with, and she was in constant discomfort. Donna is Peggy's therapist. Donna is certified by LANA, the Lymphology Association of North America. She's also Pinnacle Health's STAR program coordinator. STAR is a survivorship training and rehabilitation program which works to restore quality of life after cancer treatment. Peggy was a patient of STAR. And in addition to lymphedema therapy, Peggy was also referred by Donna to see a psychologist who specializes in oncology patients. And Donna educated Peggy on how to perform manual lymphatic drainage, got her fitted into compression garments, and then set her up with an in-home compression pump. So some of the limitations with lymphedema, we already mentioned the stress factor, which can lead to significantly lower quality of life and higher psychological distress. But another thing that also adds to that psychological distress is the financial hardships that lymphedema can cause. Lymphedema is done by a lymphedema therapist, which is a branch of physical therapy, and most insurance companies will charge $2 to $75 as a copay per visit for lymphedema therapy. And most patients are coming 2 times a week for probably 12 to 16 weeks, and a lot of patients have to come back repeatedly because they'll let their lymphedema go unmanaged, and then they have to start their treatment all over again. In addition to the therapy, compression garments are also another cost, another out-of-pocket expense for patients. Some insurance companies don't cover garments at all or durable medical equipment, and those that do typically only cover them once per year. But compression garments need to be replaced every 6 months because they wear out so quickly. Good custom compression garments are typically going to run in the $500 to $700 range because they come with warranties. They're customized to the size of the arm and to fit into particular bulges and folds in the arm that result from lymphedema. Compression pumps can also range from $500 to $2,000, and sometimes they aren't covered by insurance companies at all. And most insurance companies will allow them to be rented, but you have to go through lengthy authorization processes to get it approved. And those who have physical therapy benefits typically only have 20 to 30 visits covered per year. And that leaves them vulnerable if they exhaust that benefit with lymphedema, that they don't have any physical therapy benefits for any other kind of therapy that's required, maybe for like an orthopedic reason. And then they're susceptible to other out-of-pocket expenses. Additionally, if a patient exhausts all of their physical therapy benefits and they don't complete their lymphedema therapy and they haven't been properly educated or they haven't been fitted for their compression garments or a pump yet, and they elect not to pay out of pocket for those visits, then they're waiting to their next benefit year before they come back, and typically they're already at risk for an infection if they haven't developed one already. So what if you can't afford to have lymphedema? Well, many patients will let it go unmanaged, and that's the absolute wrong idea. You should never let it go unmanaged because it can lead to really hard and swollen, painful limbs and breast, which may develop cracked and open sores and blisters on your skin, which leave you susceptible to infection like cellulitis, and most of the time cellulitis is going to lead to hospitalization. Women who let their lymphedema go unmanaged may put their implant or their healthy breast tissue at risk because when they develop the hard and swollen breast, their incision site can split open and they can get an infection in there, and then their reconstructive surgery has been compromised. So if a patient can't afford lymphedema products, it's recommended that they speak to a manufacturer or a special interest organization like the Pennsylvania Breast Care Coalition or the National Lymphedema Association or the National Lymphology Association of North America to see if they can get any financial assistance for those garments and for those products. These are just some precautions. If you have been diagnosed with lymphedema or you know somebody who has, you should seek medical attention at the first sign of swelling or at the first sign of a tired and achy and full feeling in your arm or chest. Have an evaluation with a lymphedema therapist, eat a healthy and low sodium diet, wear compression bras, and if you can, have an oncologist or doctor do an L-Dex test to see if you're predisposed or if you're at risk for lymphedema. So in my presentation, there are a couple of sound clips from Donna, which obviously I can't play here for you now, but I highly recommend that you check out the PowerPoint and check out those audio clips. She provides a little bit more additional information on lymphedema, some precautions for lymphedema, and then encouraging words for those who may have been diagnosed. So thank you guys so much, and I hope you have a great day.